Yes, hello everyone. In today's video we are going to look at the types of diabetes. Still Musau Faizo as usual, so if you're interested, please keep on and watch until the end. You can even subscribe. So in our previous video we saw that your diabetes is increased in the blood glucose levels are beyond the normal ranges. So we have type 1 diabetes, type 2 diabetes, we have gestation diabetes. In type 1 diabetes, our body does not produce insulin at all. So the beta cells of the pancreas do not produce insulin at all. So once you eat food, the end result will be glucose, which glucose will be introduced in blood. So once it is introduced in blood, there should be production of insulin. It triggers also the production of insulin, which in this case it is not produced, meaning that these blood glucose levels will be high, will not reduce. It accounts for around 5 to 10% of the cases. In the past it used to be called, also referred to as insulin dependent, whereby you depend on insulin outside the body, from outside the body, or juvenile. But nowadays, because also in type 2 we find patients who probably need insulin, so we no longer call it insulin dependent, we prefer type 1. Then in type 2 diabetes, you find that your body beta cells of the pancreas produce less insulin, or your body does not effectively use the insulin produced, which we call insulin resistance. So in insulin resistance, or in type 2, the blood glucose levels will be high because the insulin produced is less, or your body does not respond or effectively use the insulin. We do have gestation. Then this accounts for around 90% of the cases, the type 2 diabetes. So we also have gestation diabetes. This is always in pregnant mothers. So we find that the placenta hormones also increase the resistance of insulin. So this will lead to build-up of insulin in the blood of the pregnant mother. So it is very important you also acquire this, you distinguish these types of diabetes.